We're going to look at the pelvis and the sacroiliac joint and try to sum up some different ways to address things like pelvic rotations and pelvic upslips that can be painful and cause weakness and dysfunction in many people. So the first thing we're going to talk about, when the pelvis gets out of alignment, you have a leg length discrepancy. One leg may be longer than the other, but with your pelvis being out of alignment, many people have success in treating their pain and their weakness by maintaining their pelvic alignment on their own outside of therapy and then after they've been discharged. So we're going to talk about a pelvic rotation. The first one, if someone has a rotation, the way that we would address that first would be to decide how it's rotated. So first thing we'll check is the leg length. So for Simone, I'm going to have her do just a bridge really quick. The bridge just kind of sets the hips in a midline position, and then we bring the legs down straight. So if she's doing this on her own, she would do is bring her feet together and kind of peek down at the tops of her shoes to see if one leg is longer than the other. We can see that her right leg is a little longer, but she can see from up there. So I try to include the patients as much as possible in seeing this so that they can learn it as they go and self-treat. With her legs being this way, right leg is longer, left leg is shorter. We're gonna figure out why. Having the patient learn this is sometimes easy and sometimes not. Some people cannot find where their pelvis is. So feeling the front of their pelvis and trying to decide if one side is higher than the other. This is in a patient who we know has equal leg lengths, not someone who maybe has a longer leg from childhood the way it grew. This is someone whose pelvis is just uneven, and because the leg's attached to the pelvis, it takes the leg where it goes. In Simone's case, her right leg is longer. I'd like for Simone to try to figure it out. The way I would have her do it is kind of feel for the bony, pointy part on the front of her pelvis right here. And I try to take her thumbs and kind of find those spots to see if one side's higher than the other. The left side is higher over here and her left leg is shorter. So when the leg is shorter and the pelvis is higher, I point to the direction that they went. The foot went that way, the pelvis went that way. So they both went in the same direction. So we have what's called a pelvic upslip. The correction for that is one of two things. One could be a friend or family member that's been trained here in therapy. We'll have them come in and learn how to do it. Do a gentle pull on the leg. We're not yanking on the leg. We're not trying to dislocate any hips or pull too hard. We're able to pull just hard enough to get the pelvis back to level. We can do it one of two ways. I can have her bend this knee and put her foot and kind of stabilize that way. That does work for many people, and that way the person who's helping can give like a gentle pull here and then their hands are free. Personally, I like to do it a little different because I feel like I get a little bit better stabilization because you have to stabilize the opposite side of the pelvis to get this side to pull down. I would sit down for it, and I always just grab a towel because we don't know where that shoe's been, on the ground outside somewhere. So I would stabilize here just to check to make sure that they feel okay with me grabbing their ankle there and pulling. Some people might have a sensitive ankle, so I'm gonna stabilize here, my elbows against my body, and then the other side I'm just gonna give it some tension and just kind of pull on it. And I move it up and down, and that's just gonna give it enough traction to correct the upslip on that side.